And the most rewarding is not the degree itself, is that when you practice and you apply what I clinically learned and to see patients get better. And these are patients that everybody runs away from. I'm the opposite. I don't give me the patient that is simple. Give me the one that has been through several physical therapists already and has not gotten better. And I think that's where my private practice is now, is the patients that I'm getting are by word of mouth. And these are patients who've already been, oh, you're my fourth physical therapist. So you can imagine the frustration, the bias, physical therapy doesn't work, and to see them finally get better.
PT Meal Podcast, where we ingest and digest physical therapy information from physical therapists around the world with a Filipino twist. With your host, Johan De La Paz, a Filipino physical therapist who has worked in different practice settings from the Philippines and here in the US. Let's indulge and satisfy our cravings to learn and be inspired.
All right, welcome back to PT Meal Podcast, a buffet of play, therapies, movement, exercises, activities, and leisure, all packed in a hearty conversation of physical therapy profession and practice with a Filipino flavor. I am Johan De La Paz, your host. Welcome back to the banquet. Again, for those who are listening to the podcast for the first time, this podcast is available in your favorite podcast apps in Spotify, Apple Podcasts, Google Podcasts, Anchor, iHeartRadio, Amazon Music, and many, many more. You can also watch us, the full episodes of most of the podcasts in YouTube. And if you want to stay updated on fresh episodes, interview snippets, research abstracts, or infographics, follow the social media accounts of the podcast in Facebook, Instagram, LinkedIn, and Twitter. You can also check out some merch on Etsy.com. Just search for PT Meal Shop, one word. And all the links and content are all available in the website, ptmealpodcast.com. All right. So let's go on with the show. So my guest for today, we are going to talk about another academic option for us physical therapists aside from PhDs. So my guest is Janise Alcantara. She is a private practice owner, movement medicine physical therapy in Culver City. She finished her bachelor's of physical therapy in Cebu Doctors College, now university, and finished with a magna cum laude. Right? Amazing. And she is a fellow in training with the North American Institute of Orthopedic Manual Therapy. She is a clinical instructor with the Physical Therapy Advancement Seminars, comprehensively trained in Pilates, trained in Redcord, Neurac, and also a Certified Kinesiotaping Practitioner. She is also a certified clinical instructor from with the APTA and a member of the American Association and Philippine Association of Orthopedic Manual Physical Therapist. So her previous work includes being a director of rehab in a skilled nursing facility. She worked in home health, acute care, subacute care, wound care, early intervention, pediatric physical therapy, outpatient mobile therapy. So there's a lot. And she is now finishing up her Doctor of Science in Physical Therapy at St. Andrews University with a concentration in orthopedic manual therapy. So let me welcome to the podcast, Janise Alcantara. Janise, glad to have you here.
Thank you, Johan. Thank you for inviting me. Yes.
Yeah. So thank you for sharing your time after work. So I know you're tired, but at least we're going to hear about your experience, as I've mentioned, with another academic option, a terminal degree, aside from PhD. When I was starting here in the US, I was like, if someone wants to continue their studies, sometimes they look at like masters or, terminal degrees like PhDs, right? But there's another option, DSc, which I just found out here. So hopefully other physical therapists would learn more about that, and probably that can be an option for them. But before we dive into that, could you give us a short introduction? How did you become a physical therapist? Why did you become a physical therapist? And now what are you doing right now?
So how I became a physical therapist, it's I've been a PT now for over 20 plus years. And how I got into the field, I only had, I think, one criteria when I finished high school is that I didn't want a job that was sitting at a desk. Nursing, everybody was taking nursing, so I wanted something different. And that's how I ended up in the field.
Mhm.
It had its struggles coming, as I think, as most foreign trained physical therapists, we all had the struggles and how we got here to the US, going through the visa and stuff like that. But when I came here in the US, my first job was I work in early intervention in pediatrics. It was in the state of Arkansas. I think I lasted about 6 months in that job. And then I realized it really wasn't for me. Pediatrics just was very difficult. So I decided to move to California and then did my period of clinical service in California, which was lucky enough I was able to do it in an acute hospital in downtown Los Angeles. And then from there went to SNF work. And then just because my company has contracts with several, so it was mostly a lot of SNFs, subacute, and then a little bit of, they made me work in an outpatient. So it was a lot of different settings that I got exposed to. And then I decided to move into outpatient in 2018 after, I think it was just PDPM that drove me.
Yeah.
I think it's time to make a change. So finally, now I opened my own practice last year. I'm now in private practice. It's just me and my husband. We do, one-on-one, not a very big clinic, but right here in West Los Angeles. So, it's we're just starting, but it's gaining a lot of ground and, starting to get busy. But yeah, it went from working for a company to now being a private practice owner. It has its challenges, but I still, I think people find that I really still like my work a lot. And I really find I'm still very passionate about the field. And I do love, finally, I have a say on what I can do.
Uh-huh. So it's more of being your own boss and being in more of control
Yeah.
than other,
I think
insurances
it was time.
uh-huh.
It's not really that I hated working for somebody. It was very convenient at the time, raising a family, being having the 9 to 5, and once you clock out, you're done. You don't have to think about it. When you're a private practice owner, you still have, there are things that you still bring home with you. So you never really turn that off in your head. So it does have its positive, its pros when you are an employee and you work for a company. And then also the flexibility of work when you have kids, you have no nannies and you're raising a family. So the flexibility in the schedule really helps a lot. So, it was very useful at the time. A lot of people have asked, do you think you should have opened a long time ago? And I said, no, there's no way I would be able to do what I'm doing right now, even 15 years ago, because I still had the babies, and then it was just a much different time. I'm glad I started it here after I've finished my after I passed my exams for the SEMPT exam with NIOMP and my spinal manipulative SMT exam with Aspire OMT, and then now I'm finally done with most of my credits with the DSC. I feel like that is much, I can apply finally everything that I have learned and everything comes together. So it is the right time. I don't think it was ever should I have started sooner? No regrets.
Proper timing, really.
Yeah.
All right. So let's dive into the topic. So Doctor of Science in Physical Therapy. Could you tell us more about it and how is it different from the traditional PhDs?
Yes. So PhDs, I think it's much more research. I mean, there's a heavy research focus, but there's not a lot of clinical application because it's really more academe and more geared towards that, right? But I think people find confusing is that, okay, what's the difference between a DPT and DSC, right? So the DPT is an entry-level doctorate physical therapy. So it allows you to become an entry-level doctorate of physical therapy with entry-level clinical skills. Now, if you're talking about DSC, I think to make it in layman's terms, it's more of a combination of your DPT, but also your PhD, but then at the same time, you add a clinical application component to it. So it's a combination of both. And I think the beauty of that is because if you are a physical therapist who aspires to be in the academe, this is a terminal academic degree. So it does allow you more opportunities in academia later on in your later years, but it's just a heavier, I would say a heavier caseload because there are more units. There's also research focus as well. But then what I chose one that have a clinical focus in orthopedic manual therapy. I just thought that it was, to me, it serves what I really wanted to learn that would help me become a better and a master clinician should I open my own practice.
So is that the main reason why you chose DSC, is so that you can apply that in your own practice?
I could apply it in my own practice. And at the same time, I think initially, because I think it just happened to meet my needs as to where I am in my career right now. I have been a PT now for 20 plus years. And then, going to, of course, we're all encouraged to get a transitional DPT. But when I look at the curriculum, I didn't see anything that was more clinical applications for me. I mean, there is clinical applications, but I didn't think I could learn any new clinical skills because I have been practicing for so long in so many different settings. I wanted something that would really challenge me, get me out of my comfort zone. And it really did. I'm talking about like really crying at times. And then, and at the same time, I needed something that was, if I was going to spend this much effort, which I know what people are going through when they go through the transitional DPT, like, aren't you glad you're done? Right?
Yeah.
So I needed something like, okay, if I was going to do this, it has to be something that would, maybe in my later years, if I decide I wanted to be changed to academia and my physical body is no longer able to treat, I would have that option of teaching just full time. So it was sort of like, it just hit all my needs right at this point of my, at my stage in life. Yes.
Right. So it challenged you. It gave you an opportunity to apply that on your clinical practice, and also served you a purpose of, in the future, in case, you don't want to have patients anymore, you'll be able to transition to academia.
Yes. And I think to answer that question also is that, you hear this from Filipino physical therapists. There's always this question, should I spend my money on a DPT, or I really want to learn more clinical skills? Would I rather spend my money in continuing education and gain more clinical so I become a better clinician? But do I really need a doctorate, will it to upgrade my profession, my credentials? Think about combining both. That's what I think, just that to explain it in a much simpler term. So you're combining that dilemma that they always have. Oh, should I go the DPT way, or why don't I just go for a fellowship in orthopedics? So this one, the program that I'm in, I went through orthopedic manual therapy training, and all that training gives me academic credits towards my doctorate of science degree.
Oh.
Yes. So I did it. It's like hitting two birds in one stone. So how I found out about the degree was, I think I took a class with IPA, the Institute of Physical Art, right? And if they have a very good program about CFMT. But while I was taking the classes, a lot of really good manual techniques, a lot of PNF, everything, it was very, very eye-opening. I learned a lot. But that's how I found out, like, okay, my question was, if I do this intervention, what is my clinical reasoning? Why would I choose this versus this and this? How do I learn that of clinical reasoning, right? To discern that this intervention is better. No, this movement is better. No, you're going to do better with just this and that, right? And that was, I think, the missing aspect. And that led me to the NIAM website. And I look at the NIAM website, oh, if I do their program, I actually can get academic credits towards a doctorate of science. So, and that led me to Andrews University. So I just randomly did an application, and for some reason, Dr. Kulan said, okay, you need to start this year. Okay. So I didn't know, like, okay, what is this academic plan? And then I didn't even think about it. Oh, this is your academic plan. Oh, okay. And then I look at the academic plan. It's 3 years and it's 65 units. That's a lot.
Uh-huh.
I've never gone to an American university, so I don't really understand what 65 units would mean for my time.
Mhm.
I didn't really budget until I was in school, and I realized, okay, 12 units working full time and two kids and doing the OMPT classes, and I have an exam. This is a lot. So yeah, it was kind of like learn as you go, but if once you're in there, sige, bahala na.
Uh-huh.
Tapusin mo na lang.
So was your program only 3 years, or does it?
No, that's my academic plan.
Okay.
But I decided to, because I was working full time, to just do it like 6 or 7 units per semester. There's no
Mhm.
way I think my time would have allowed me to do 12, 15
Mm.
units at a time, not to mention the classes and the testing. So that
Mm.
I think was the biggest. And it's a lot of reading. It's to do both a research focused program at the same time, learning new clinical skills. It's
Right.
like, and then working full time. So it can be very demanding, but at the same
Uh-huh.
time, very rewarding.
So it can that program can be done full time and also part time if you're
Yes,
working.
yeah, they
Okay.
give you, it really is, it's a program that was made for working clinicians already. So
Mhm.
I think a lot of people I've met in the program are either in the later parts of their career already, and they're
Mhm.
doing it because they want to now transition to academia or research because they've
Mhm.
already been more established clinical wise in their career,
Mhm.
or they're more of they're just starting and they want to gain more out of it as well. So built into the program is actually, with the one for Anderson University, is you can actually do both. Built into the program is the DPT program, transitional DPT.
Oh.
It's just more.
Uh-huh.
Yeah, so you can actually get a DPT and a DSC from the program, but how many Ds can you get?
So you're gonna end with
No,
a program
I didn't
DPT
apply for
DSC?
the DPT.
Okay.
No. Yeah, it was just no.
Oh,
You
but
just,
there's a program that you can do DPT and
no, the DPT academic plan is, if you look at their academic plan for transitional DPT, it's already part of the DSC.
gotcha.
So if you just choose to be in both, you actually could graduate with both.
Uh-huh.
Yeah, but what is really the clinical utility of having?
Mm-hmm. Gotcha,
So,
gotcha.
yeah, but I did have a classmate who did both. So
Oh, really?
yeah, she said,
Just
yeah,
to get the
you
Ds.
can do both. And I said, how many Ds do you need?
All right. So we touch you touch on the orthopedic part of the curriculum.
Mhm.
Can you describe more? Elaborate on what the program is like.
So Andrews University right now, if you look at APTA, there's a lot of DSC programs, right?
Mhm.
They have a list of schools that offers this higher academic, terminal academic degrees with different focuses. I think the beauty about with Andrews is now they have different focuses. You can choose to have a women's health now. I think they just
Oh,
opened that
wow.
a year or two ago.
Mm-hmm.
And now they opened one for OTs, a DSC for OTs. And then there's one, of course, the initial opening was for orthopedic manual therapy. So now they have different focuses, and I think they even have one now for education.
Mm-hmm.
So if you know Mark, he's on that education track as well.
Oh,
Yeah.
okay.
So you can choose that, depends
Mm-hmm.
on what it is, what field. So, the beauty is that your DSC is academic, like it still gives you that terminal academic degree.
Mm-hmm.
So the orthopedic manual therapy is, all the training I took was under NIAM, the North American Institute of Orthopedic Manual Therapy. So I did all their classes. So it's the same as taking a continuing education class. So you have that lab intensive on-site classes. You have, OMPT instructor, and then from that on-site class though, but because it's part of your academic degree, you don't just do the class and you're done. There's still case discussions that you have to finish, and there's still exams that you have to take because it has an academic credit. So now there's just more work to be done after the class.
Uh-huh.
So you have two options. You can choose to either take that class as a continuing education, or take that class as an part of your DSC program. So I think with my orthopedic manual therapy is, that they have this. When I started with them with NIAM, they had this level 1, 2, 3 classes. So in level 1, you understand the basics of clinical reasoning.
Mhm.
Then in level 2, you learn more interventions. And then in level 3, they even, now you're addressing the whole body and stuff like that. So, but since NIAM separated from Andrews, now I'm kind of stuck. Like I'm now part of NIAM with my fellowship in training, but something to do with how Earl Peckman separated and formed his own Aspire OMT. So some of my exams is with Andrew, some is with Niam. Let's just say I'm just all over the place. So, but the mentors, I think the strength of that program is the mentorship. Really, you met so many great instructors, very very good instructors, and learned so much. So, yeah.
And does your program also include like teaching courses?
Yes. I took they taught leadership courses. They taught how education courses in healthcare, learning how to leverage current technologies in teaching methodologies, concepts. So very, very great. It's not just all clinical. So aside from the research, there was a lot of leadership and teaching courses. Really, I think this was the most I have ever learned when it comes to teaching, because the last time I taught was 20 years ago, right after college. So yeah, very different now. We have so many technologies. So yeah, that's part of that. Yes.
I remember when the DSC program was introduced to me by Mark before. I was looking at the curriculum, and I remember a practicum part that you're gonna teach students within that program. Is that still there?
No, the practicum wasn't. Depends on your focus.
Okay.
I think maybe because I'm not on the education track, so it might be the practicum that he's gonna be doing. Since I am on the orthopedic manual therapy track. The practicum hours is the clinical supervision hours that I'm doing under my fellowship instructor. So my fellowship, actually, all the hours I'm doing under my fellowship is also under my DSC. So you see why I'm in the fellowship, why I'm doing the OMPT exam and the DSC. So I just put them all together. I thought one big effort, get it done.
Gotcha. And as a last requirement, does the DSC have like a thesis as a
you do have to have a dissertation, and of course you go through all the process of your research proposal. Yes, which is where I am right now. So my hair is a little bit.
But yeah, you're almost there. So what's the most challenging aspect of getting into a DSC program?
During the program, I think it's the challenge. A lot of challenges, but I think it's what stage in your life are you on when you choose to do this? Okay. You have to understand the demands, and I think my family can say for itself how hard it was. It did put a lot of stress and toll into your family dynamics. Then there's a lot of sacrifices as far as your weekends, my early mornings. It was just all PT 6 or 7 days a week. So it was really a lot of like just trying to balance, because there really isn't a balance. I think I just chose to say, if this is what I chose to work and study at the same time, so this is what's going to be the bulk of that time. There's a lot of things you have to give up. Going out, saying no to a lot of invitations. I could not. My weekends are no longer that free. Even watching Netflix is already a luxury for me. So yeah. So yes, it's actually the demand that it takes in you. So when you have a family and you have younger kids, or if you have a newborn, I think it's very demanding, and you have to be able to comprehend and understand that it will take a lot of those time hours. So, choosing to do that at what stage in your life, make sure that at least you have that, you have to have that support. There's no way it can be done without the actual support of your colleagues and your friends, and especially your family.
Mhm.
And your spouse. I have to give credit to my spouse because I think he did a lot of sacrifice. I did so much travel.
All right. Also, aside from spousal, family, and your support from friends and colleagues, how else were you able to cope with the stress of being in a DSC program?
It is actually have, I think a lot of that support too is coming from the classmates and friends and your professors.
Mm-hmm.
They gave me so much guidance and, assistance as well. Okay, you need this, resources, assess, you need this, I'll get that for you. Oh, this is what you did. So you meet a lot of, professional colleagues and
Mm-hmm.
the assistance they give you as well, the support they give you. And, you travel 3 times a year. 3 times a year, I would be flying to Chicago and then drive 2 hours to overnight to Michigan. So it was literally like I would fly. It's a 4 hour flight to Michigan, to Chicago. Then from Chicago, I would drive to Michigan, which is another 2 hours. And then you have a time difference of 3 hours. So basically, I would arrive at 2 o'clock in the morning,
Mm-hmm.
wake up at 6, which is only like 3 o'clock here, in California. And then so that I can be in a classroom at 8 o'clock in the morning, fresh eyed. So that was really and then be there for 6 days straight and then
Mm-hmm.
back. So yeah. And then, because of that, traveling over there, I've made some really good friends as well. And
Mm-hmm.
then they provided so much support and guidance. And then, like I said, the professors, the amount of support, guidance, and mentorship, I think those were that was the best thing, I think, a part of the program.
Mm-hmm. All right. So next is we talked about the challenges of the being in the DSC program. What now are the most rewarding or enjoyable part of it?
I consider that program, it really reignited my passion for physical therapy.
Mm-hmm.
When you've been in practice for 20 years and you've done the same thing over and over again, you kind of get that, that's it,
Yeah.
right? Like,
That's
I want to
long.
retire, I want to
Yeah.
take a vacation, all that. But when I did that program, and, especially when Earl Petman is the one teaching, it really reignited that passion that you have for physical therapy. And the most rewarding is not the degree itself, is that when you practice and you apply what I clinically learned, and to see patients get better.
Mm-hmm.
And these are patients that everybody runs away from. I'm the
Oh.
opposite. Don't give me the patient that is simple. Give me the one that has been through several physical therapists already
Mm-hmm.
and has not gotten better.
Mm-hmm.
And I think that's where my private practice is now, is the patients that I'm getting are by word of mouth.
Mm-hmm.
And these are patients who've already been, oh, you're my fourth physical therapist. So you can imagine the frustration,
Right.
the bias, physical therapy doesn't work,
Mm-hmm.
and to see them finally get better.
Mm-hmm.
And, that has been the most rewarding. Instead of running away, you've been in practice. There's this patient like, oh my God, that's so many problems. It never ends.
Right.
Give him
Right.
finding somebody. I'm the one. No, give him to me. I want
Mhm.
that patient. Yes.
Mhm.
I want the complex one, because that's what I want, the tough to treat patients. Basically,
Mhm.
that is, to me, has been the most risk. I'm no longer that scared. Instead, it gives me, okay, I have to figure out a way. How do I make this patient better? And
Mhm.
that's what my OMPT training did for Andrews, and what Aspire and I have taught me, is that you have your clinical reasoning skills and your ability to just research and
Mhm.
figure out a way how to make this patient better.
Mhm. That's so amazing. That's so relatable because every PT would have that type of patient that they would run away from. That you take that patient, you take that patient.
Yeah, you take that patient. The patient came today with a back pain, and then
Uh-huh.
the
Yeah.
next session, my knee hurts now. Oh,
Mhm.
my ankle hurts now. My neck hurts. I have a
Mhm.
headache, and you just
Yeah.
oh, your authorization only says it's your knee, right?
Right. Right.
Yes.
Right.
So how do you handle that? How do
Mhm.
you handle that with the insurance? So, those are the nuances, I think were like one of the positive things that I have gained really from this program.
Mhm. That's amazing. That's so inspiring. You don't run away from challenges anymore.
Yes, don't run away.
So Can you share to us what one lesson what's the one lesson that you remember that you learned from DSC program that you apply in your practice?
I think it's Earl. Well, of course, no, it's not just like when Earl was talking about how, the stages of learning. I forgot whose concept it was, where you go through this stage of, we call it unconsciously incompetent, where you go through a stage. What is that? I forgot it. Like the
It
first
sounds
stage,
familiar.
right? The first stage, it's almost related to the Danicure. Like the first stage is you're unconsciously incompetent, and then you go through a stage where you're consciously incompetent, and then you become consciously competent, and then you become an expert, right? So I think I was stuck in that unconsciously incompetent for so long. And then when I got to the program, got worse because now you are consciously incompetent. And so you're trying to get out of that. I mean, will I ever be getting to that, what do you call it, consciously competent stage? I hope so, but I hope before I die, I get to that stage. But it's that transition from that stage to being aware of your limitations. And then now you are aware that there really is so much to learn and that it will never end, but you will constantly chip away at it until who knows where it will take you. And I think that was the biggest lesson I've learned as to how much I really didn't know. I could say I've been in 20 plus years in business and I've learned everything about insurance, how to bill smartly, how to meet every insurance so that you will get paid. But nothing really in there is as satisfying as how to treat that patient that's really tough and the most challenging.
Oh, wow. That's nice. It's amazing. I just looked that up. The 4 stages of
Competency,
right?
something like that, yeah.
Unconscious incompetence, which is ignorance. Conscious incompetence, which is awareness.
Yes.
Conscious competence is learning, and unconscious competence mastery.
Yeah, so that's like where you have an expert. Yes, I don't know who is the original. We gotta give credit to whoever.
Yeah, credit to Gordon Training International by Noel Birch, 1970s.
Okay, yes.
Yeah, that's amazing. I think I only saw this once, but since you mentioned that, it's quite interesting.
Yeah. So, and I think, and it dawned on me because when Earl teaches a class, he always starts with that concept, and I was like, it's true. And he said, the fact that you're here in this class, is already that you're making an effort to get out of that stage, the ignorant stage to the awareness stage, right? So, and it was like, okay, I really gotta listen.
And being aware is really the first
Yes,
step to it.
yeah.
Yes. All right. So, if a colleague of ours listened to this episode and wonder if this might be something for me, what advice can you give to those physical therapists of thinking about if they're thinking about enrolling in a DSC program?
If I think first is they have to really decide first where they want to be further down the line. Like, what do they envision their physical therapy career? Do they want to be on the administrative side more and be in the business, or do you want to be a clinician and be a better clinician in academia? So that path alone will tell you what higher academic degree. And because if you are more into the business, private practice ownership, do you really need a DSC? No, you can be a successful private owner and be a successful businessman without that degree. But if you want to be in the academia and you want to have higher clinical skills and you have to have a conscious decision that you are going to have the terminal academic degree. And there are so many DSC programs out there. There's PhD, ETD. So there's a lot of different terminal academic degrees. You go through the APTA website, it will have a list. Take a look at the curriculum. Is this going to meet what you envision your career would be in the next 20 years, whatever is left of your remaining practicing years? So where do you envision yourself to be? And will this program, so, and then of course you take a review of the curriculum, because there are so many focuses on this DSC program, right? So it will, I think, for some it might not be appropriate, for some it will be, but it really all depends on what you aim for, right? And what is what's your goal for the next 20, 30, 40 years.
And just like you, I think another thing to take into consideration is their current situation, because you just like what you said earlier, it's the proper timing. If you said that you know haven't done it before, probably it's not the right time, but you're at the time of your career that you want to be challenged, you want to apply this in your
and there and there are other ways to do it. You don't have to do it like I did, where I went all gung-ho and say, okay, enroll in the program and do everything else, right? If you have limited time, do the transitional DPT, right? Because it's the workload is easier. And then when you do the DSC, your DPT they will give you academic credits for that. So then your DSC program will only be half, not like me where I had 65 units. It's a lot. Or if you do not want the demand of being in an academic class, do the continuing education. If you want, for the OMPT, take the on-site classes, prepare for the exam, which is at your own pace. And then when you're done with the CMPT, COMT, and the spinal management therapy class, whether it's Aspire, they will give you academic credit for that when you're done. And then you enter the DSC program. Does that make sense? So you don't have to do what I did, where you did everything all at once. You can do them bits. You can do the clinical training, the OMPT, do the fellowship. When you're done the fellowship, you can still do the DSC, but it will be at half of the academic credit. So it will actually be lesser work and actually finish it in 3 years. Not like me, that's going to take money.
Right.
Yeah. So that's another, so that my advice would always be to, like, you don't have the time, don't do what I did. Do like the other way, like I just told you, do it bits and pieces, and then just apply it. So in the end, you will still have the degree. Yeah.
Right. Good. You dip your toes in stuff first and see if you wanna.
Because there's no pressure if you're not in academic class. You can take the exam when you need to, when you want to, and you can just study when you have the free time, and not where if you're in academic class, you have to take that exam within the 3 months or 4 months of that academic class. So you really have to study. Yeah.
Right. All right. Great advice. So, Janise, thank you very much for coming to the podcast and sharing with us your insights and your experience in being in a DSC program and getting that Doctor of Science in Physical Therapy degree. Before I let you go, I have my last 3 bites, my last 3 questions for you. It's not related to our topic anymore, but something about you. We want to know, some questions about you as well. My last bite is, what is your recipe for success?
I think, of course, number 1 is your faith. I'm not talking about religion. Okay. It's more of your faith in something higher. Doesn't matter who you believe into. Second is humility, or that, and third is resilience. No matter what, I mean, life is never gonna be a straight upward path, but we keep on, right? Then I think also health, whether it be physical or mental, is one of the biggest factors as well. So you cannot serve other people and practice if you don't have your health, even your own family. So I think having all of that, I think it's what makes for a much more rewarding.
Right. So faith, humility, resilience, and health are the stuff that pushes you to succeed. All right. My second last bite is, aside from the DSC program, how do you continue to sharpen your knives? How do you continue to develop yourself?
Oh, A lot. I think it's the drive. I'm always really interested. People call me a geek or such a nerd. Even my husband says, when do you turn off being a PT? Doesn't everything is really to me like that interest to always constantly be learning. I think that's what drives me. And I think it's more like, how do you keep that fire going, right? Yeah.
Right.
So it is really much more intrinsic, more internal in a sense. Yeah, that's what I think. Yeah.
So what is one way for you to keep that fire burning? Because a lot of our colleagues now are getting into that sense of slump or burnout. Even
Mhm.
even young colleagues, I hear that they're already burned out. So for you, how do you keep that flame burning?
Oh, that's a tough one. I've been there. How do you
Mhm,
keep the flame? It's a conscious decision, I think.
mhm,
It's I've been there. You're sitting in a meeting, right?
mhm, mhm,
All those interdisciplinary meetings, and you're like, my God, I've sat in these meetings for forever, and it's still the same results,
mhm,
right? So, it's a conscious decision. I think it is not. I never really look at, oh, it's this person's fault, it's my company's fault, it's this. If I It's always been, if you want to make a change, if you're burnout, I don't blame anyone except I consider myself, I am responsible for everything. If
mhm,
I'm burnout, it is not my external. I'm burnout because I allowed myself to be burnout, right?
mhm,
So it is a conscious, I think it's more of a conscious decision that it's you are ultimately responsible for everything. It cannot be your family, it cannot be spouse, it cannot be your coworker, it cannot be a tough patient, or it cannot be your boss, that's stuff, or the company you work for, or you could say. And a lot of foreign trained physical therapists as well are, especially the younger ones, that when they come in and they say, oh, I'm stuck in this because I'm under petition, right? I'm on an
mhm,
H1B, or I need to get this. I cannot really transfer jobs in the contract. What do you make of that situation? If you're going to be stuck in a job that you're not 100% happy with, then learn as much as you can from that, right?
mhm,
And so do not just think that, oh, just because you work in a skilled nursing facility, I'm not going to learn anything. I
mhm,
learned a lot in a skilled nursing facility.
mhm,
It's where I got my primary care skills.
mhm,
And I think that helped me with the OMPT, because when OMPT was training me
mhm,
to look for red flags, it's easy to read that in a book. But
mhm,
when you actually have the red flag in front of you, do you recognize it?
mhm,
That is what I learned from when working in SNFs and long-term care. Is I can already pretty much assess and much more confident. Okay, this is not something that this is something I need to farm out. This is a 911 call,
mhm,
right? Or this is something you need to go, like today, go to your
mhm,
primary care physician, or go to urgent care, or
mhm.
to be able to direct that. So yeah, it's just because you're stuck in a situation doesn't mean it's, but a lot of people, right, look down on SNFs.
Right. And it's surprising because you wouldn't think that you can apply primary care physical therapy skills in SNF because there's a lot of like nurses there.
Oh,
You would think that okay,
no,
they would know that. I don't have to,
no. I think it's one I'm going to really encourage, and because I read social media groups, right? And
Mhm,
there's a lot of disparaging comments when it comes, don't work for long-term care because of productivity guidelines. Don't work for long-term care because you're not gonna get, it's all that. Do you know how much you can learn from these patients?
mhm, mhm,
Massively. How are you ever going to have the chance? When are you ever really going to have the chance to work with a patient with multiple medical conditions, interacting with each other, how this affects, have a chance to look at their current medications, how they're interact, have access to their labs, be able to work with a ventilator dependent patients, look at their, all that.
mhm,
Oh, this patient is stage 4. What can you do? It's not just pressure relief when you come to wound care. There's a lot of things that you can do. PT.
mhm,
So all of those things I learned are really valuable today. Like
mhm,
as a private practice physician, because like I said, I have the tough to treat kind of patients, right?
Mhm.
So yeah, it's your outlook. That basically what I'm saying
Right.
is that if you think you are stuck in that situation, then you are going to be stuck. But
Mhm.
if you feel like, if you take a look at your situation, I'm in this situation, but it may look like to others like I'm stuck, then I'm going to learn everything I can out of this situation. So that when that door opens, you're ready to
You're
fly
ready.
with as much knowledge as you can carry from whatever situation you're on.
I love that. Taking responsibility and making the best out of
Yes.
your current situation. I like that. My last bite is, what are the three ingredients that you always carry with you each and every day of your life that you think are essential? In short, what are the three ingredients that make up Janice?
Oh, you got that stuff.
It can be a motto, a statement, a verse,
My
a
God, I don't even have
value,
one.
characteristic.
What makes I think just positivity
Hmm.
in a sense. No matter how hard the day is, and no matter what challenges I have for the day,
Hmm.
I've always ended the day with a positive statement. Okay, tomorrow I'm gonna get this, and I'm gonna get that, and this will happen, and it always does.
Mm.
Yeah. So I have learned to take away negative connotations, I think, from my day-to-day affirmations that I have in my head, instead of, oh, tomorrow is going to be a very heavy day, I have
Mhm.
this many patients, and tomorrow I have all of this with at home needs to do. So it's always a positive. Okay, tomorrow this is what's going to happen, what's going to, never a negative. So I think it's just that positivity. I think it's always what I carry.
All right. And that's it.
It.
Okay. All right. Again, thank you for sharing your time with us after work. You know, sharing us with your insights and what we can learn from it. I
Mhm.
love that we talk about in those last bites. It's very relatable, and for colleagues that are experiencing that, that is something that they can think about.
We've been there.
Yeah, we've been there. you
We've
know
been there.
it's not a matter of like how many years you've been working. You would feel that at some point.
Yeah, I've
Mhm.
been there.
Yeah.
So I totally, I really feel for younger colleagues that, there's a lot of sometimes really, when is this going to end? Right.
Mhm. That's
So we've
true.
been there, but
Uh-huh.
if you will get out of it, and you will be in a better place as long as you keep on one step forward.
Right. So as to end, when we as Filipinos, we usually end our gathering with leaving our guests with their pabaon, mga Tupperware to go. So what is our takeaway from our whole conversation today? What is that one thing that you want our audience to remember?
Especially for our physical therapy audience. Okay. I think that, especially for our Filipino colleagues, I really feel the challenges of how to make for the financial challenge of trying to make a living, right?
Right.
So then there's always the dilemma: should I apply AIM to be out of the country, or should I stay back home?
Mm-hmm.
Um, for our Filipino colleagues, especially, I think if you really look at where we are now in the country, like with all this, now that we have this social media, with everything that is much more accessible, if you push at it, I think they have better opportunities of making it back home now than what we had back then.
That's true.
Yeah.
I believe that too.
Right. I think you can make just as much of a decent living back home in the Philippines if you push at it, if you persevere enough, and you have more opportunities now than what I had back then as a younger new grad physical therapist in the late 90s,
Mm-hmm.
So do not despair. I think if you push at it, if you really want to have your own clinic back home in the Philippines, go for it,
Mm-hmm.
right? I think that opportunity is there. Grab at it, open that, get that fear out. I mean, you will never get that fear out, but no matter what, go for it.
Mm-hmm. And push on.
Yeah.
That's true. Like it's talking about business, it's easier. I think it's easier to make a business, to open up a business in the Philippines than here, because there's a lot of requirements here, insurances,
Yeah.
liabilities.
Yes, that's true. Like, but back home there's no insurance. It
Hmm.
will be cash.
Yeah, that's true.
So learn how to sell. Start
Hmm.
start small. Like everybody does the home care, right?
Hmm. Right.
Okay, then sharpen your clinical skills to the home care until you get your brick and mortar clinic. Now there's so many opportunities, and so many small towns, they don't even have physical therapy clinics,
Hmm.
right? So I think that, there's a lot of opportunities if you really, and I think, you will meet some of the clinicians through the physical therapy advancement seminars. They
Hmm.
have clinics
Hmm.
and they're actually doing well. So it is possible,
Hmm.
right?
Yeah.
So, yeah, you don't have to leave the country.
Hmm. True.
I hope not. I really hope like soon,
Hmm.
if given the opportunity to really assist our physical therapists back home where they have to leave their own country, who wants to leave, right? We would rather be back home. Ask any of all of us, right? We all
That's
want to go home.
yeah. If I could do that, I'll be home.
Yeah. Yeah. If I could do what I do here and do that back home, I would too. But fortunately,
We're
I've
here.
already made my bed.
All right. Thank you again, Janise, for being here, sharing your skills, your knowledge, your wisdom with us. I hope to have you back for
See
another
you somewhere.
episode. We will talk more. So if our colleagues want to reach out to you and interested in the program, where can they
Mhm.
reach you at?
I am on LinkedIn. I'm on Facebook. I have I think my clinic website has an
Mhm.
email on it.
Okay.
Info at Movement Medicine PT
Mhm.
and .net. So all of that, you can reach me. It's easier. So yeah.
All right. We'll put that in the show notes. Again, thank you very much, Janice. Thank you, everyone, for watching or listening to the podcast. Catch us next week for another interesting topic and interesting guest, valuable, messages and experience. Until next
And
time.